Come in.
Hi, Mrs. Jones. My name is Nicole. I'm going to be your nursing student today.
Hi, Nicole.
Hi. I have your physician's orders, and he is ordered to have an IV put in today for 2 days for the blood that you're going to receive later, okay?
Okay.
Okay, and because you're getting a blood transfusion, it's going to be a 20 gauge needle. Can you go ahead and verify your full name for me, please?
Sarah Jones, 5/28/66.
Okay, and that's your date of birth. Okay, great. All right, so I'm going to apply clean gloves, wash my hands. Do you have any allergies, Mrs. Jones?
No, ma'am.
Okay. So I'm going to prepare my equipment. I'm going to prime my INT extension tubing with 3 milliliters of saline solution using aseptic technique to draw up the 3 milliliters of normal saline. Saline. I'm going to attach it to my extension tubing, and then I'm going to prime the tubing with the saline, maintaining aseptic technique. Going to unclamp it. Okay, it's primed. Maintain positive pressure on here. It's all set. Send it back. Okay. So, Mrs. Jones, are you right or left-handed?
Left.
You're left-handed?
Mhm.
Okay, so I'm going to use your right hand. Have you had a mastectomy on either side?
No, ma'am.
Okay, so I'm going to go ahead and use the right-hand side now, and I'm going to prepare my tape, which I have it prepared, okay? So now I'm going to select a vein. I'm going to choose a vein that's the most distal site to, in the non-dominant hand. I'm going to avoid painful veins to palpation. So, do you feel any pain with this?
No.
When I press in the palpate? Okay,
Mm-mm.
that's good. Okay, so I'm going to choose a vein that's bouncy and not cord-like, and this one is good. And one that will not interfere with the patient's activities of daily living. So I'm going to go ahead and apply my tourniquet. So lift your hand, Mrs. Jones, and that's going to be applied 4 to 6 inches above the insertion site. That's right there. Okay. Now I'm going to apply clean gloves, and I'm going to cleanse the site with alcohol and allow it to dry completely. I'm going to check for the radial pulse, and it is present. Okay. Now I'm going to insert the catheter, bevel up. Okay. You're going to feel a quick, sharp stick, okay? I'm going to pull the skin taut to stabilize the vein, bevel up at a 15-degree angle. Okay. 1, 2, 3. Then I'm going to observe for a flashback in the chamber. I see the flashback. I'm going to advance the catheter an 1/8 to 1/4 inch further while it's flush with the skin. Now I'm going to loosen the stylet and advance the catheter until the hub of the needle rests at the insertion site, and I would remove my stylet. I would release my tourniquet and apply pressure an inch above the site. Remove the needle on the stylet. Okay. Now I'm going to take my prepared extension tubing and syringe of saline solution and attach it to the INT. Loosen it. I'm going to aspirate for blood return. There is blood return, so I'm going to go ahead and flush the 3 milliliter solution. And while I'm depressing the plunger, I'm going to maintain positive pressure while I clamp off the extension. Okay, so it's clamped, and I'm going to remove the syringe. Okay. Doing all right, Mrs. Jones?
I am. I didn't even feel that.
I apologize. I would leave that on, and I would remove the syringe. That's great that you didn't feel it. You're not supposed to. Okay. I'm just going to dry that a little bit. Now I'm going to apply the sterile dressing. I would label it with the date, the time, the catheter gauge, my initials, and the size. So I've already labeled that, and I'm going to cover the site and the hub. That's in my trash, and here's my label. Okay, so that's all there. And I would dispose of all of my uncapped needles and stylet into the sharps container. Alright. And I'm just going to tape my tubing, my extension tubing, in place. The dressing. Alright, Mrs. Jones, you did great. Do you need to use the restroom at all?
No, I'm good.
Okay. Do you have any pain?
No, I'm feeling great.
Okay, I'm going to lower the bed to the lowest position and get all of her personal belongings. And so now that I've completed my IV insertion, we would document the time and the date, the insertion site, which is on the right hand, the size of the catheter, which is 20 gauge because it's blood, for blood, the number of attempts, which is 1 attempt, the client's response to the treatment, she responded well, and the instructions that I gave her. Thank you.